The biggest health threat to a 24-year-old is often something you can't even see. In this explainer, we're going to break down the top health priorities for adults at every single stage, from their 20s all the way to their 60s. All right, let's jump in. So think fast. What is the single biggest health risk for a perfectly healthy 24-year-old? And what about a 52-year-old woman who's trying to balance work and family? Well, the most immediate dangers, they're not always what you'd expect. And that's exactly what we're going to do in this explainer. We're going to map out the clinical reasoning for each life stage, step by step, so you can see exactly how to connect the dots between your patient's age and their number one health risk. Okay, first up, let's talk about a relatively new stage of life that the NCLEX is now recognizing. It's called emerging adulthood. These are your patients, typically in their late teens to mid-20s, who are navigating that really tricky in-between phase. They're also the first generation to be constantly connected, and that comes with a totally unique set of challenges. And you can really see the key contrast right here. Emerging adulthood is all about exploration, instability, and constant change. New jobs, new relationships, new cities. This is so different from young adulthood, which is typically more about settling down. For these emerging adults, all that constant flux can lead to some really unique risks, like the stress of feeling behind and, this is the big one, deep social isolation. Let's make this real with a case study. Picture this. A 24-year-old patient comes in. He tells you he feels stuck. He's living at home, spending about 6 hours a day gaming, and he feels really disconnected from his friends, whose lives look perfect on social media. Right away, this scenario should be raising some very specific red flags for you. And here's the why behind those red flags. Social media can create this profound sense of isolation because it's built on constant comparison. I mean, think about it. When you're just endlessly scrolling through everyone else's highlight reels, it is so easy to feel like your own life just doesn't measure up. So for this patient, what is our priority risk? Is it dementia? No. Cardiovascular disease, intimate partner violence, or is it B, suicide and depression? The answer is absolutely B. That combination of social isolation and feeling stuck creates a massive psychosocial risk. This is the most immediate and potentially the most lethal threat that we need to address right now. All right, let's shift gears and move on to young adulthood. Now, physically, this is a time of peak health, but that can be a really deceptive advantage. It often leads to this sense of invincibility, that it won't happen to me feeling, which makes the biggest threats the ones that are hiding in plain sight. Just look at the top threats for young adults. Notice what's not on this list. Chronic diseases. Instead, we see trauma and high-risk lifestyle choices. That feeling of invincibility we just talked about, it can lead to more risk-taking behaviors. And our job as nurses is to screen for these preventable dangers and intervene before it's too late. Now, within that category of violence, we have to talk about a critical issue: intimate partner violence, or IPV. And here's a stark fact. Pregnancy is a major risk factor. This makes screening for IPV in prenatal care an absolute non-negotiable must. So how do we actually screen for IPV safely? It's a simple 3-step process. First, get the patient alone. You can always use a clinical excuse, like needing a urine sample. Second, observe for red flags, like a partner who is way too controlling or who answers questions for the patient. Finally, when you're alone with the patient, you ask a direct but safe question, like, do you feel safe at home? Okay, so as we move from the external risks of young adulthood, the challenges of middle adulthood, say from ages 35 to 64, they often shift to these really intense internal pressures. This is the sandwich generation, where people are often caught between caring for their aging parents and their own children. It is a lot to handle. And this is the sandwich generation in a nutshell. They are being pulled in a million different directions by all these competing responsibilities, and it can lead to profound exhaustion. We're talking emotional, financial, and physical. Remember our 52-year-old patient from the beginning? She's juggling a full-time job, 2 teenagers, and caring for her father with dementia. But the single biggest red flag on this slide is that she's stopped doing yoga. She has given up on her own self-care. And that's exactly why our priority nursing diagnosis is caregiver role strain. When a caregiver starts to neglect their own well-being, it's like the foundation of a house starting to crumble. If that goes, everything else is at risk of collapse. Now, beyond the psychosocial stress, our focus on physical health also shifts in middle adulthood.
We move away from preventing acute injuries to proactively screening for the onset of chronic diseases. It's a really critical change in our priorities.
And let's be crystal clear about our terms here. Primary prevention is all about stopping something before it starts. Think vaccines, healthy diet. Secondary prevention is about catching something early, and that means screenings. In middle age, our priority is all about this early detection through secondary prevention.
So, what are the essential screenings for this age group? Well, the guidelines are clear. Colorectal cancer screening now starts at age 45. Plus, we need to be empowering our patients with education on how to do monthly self exams for breast and skin cancer. We've got to help them take an active role in their own health. But it's not enough to just give instructions. We have to make sure our patients truly understand them. So please, never just ask, "Do you understand?" Instead, use the teach back method. Ask them to show you or explain it back to you, like, "Show me how you will take this medicine." It's the only way to be sure. We have covered a lot with ground, so let's do a quick high-yield recap. This is the essential clinical logic you need to know for your exams and, maybe more importantly, for your actual practice. So here it is, all summarized. For emerging adults, we're assessing for the risk of suicide and depression that's linked to social isolation. For young adults, we're screening for preventable trauma like accidents and IPV. And for middle adults, we're focused on identifying caregiver role strain and promoting those critical screenings for chronic disease. And always remember why this stuff is so important. That focus on early detection isn't just a concept. Catching a cancer early can increase the 5-year survival rate from just 10% to a staggering 90%. Our assessments truly save lives. So, here's a question for you to take into your next shift. Who on your patient list is facing a hidden life stage specific risk that no one else has seen? And now that you know what to look for, what are you going to do to help them?